I think the horizon, the trends that we are seeing today are indicating that this technology is just going to explode and be integrated into everything we do in nursing, or many of the things that we do in nursing, and that's going to change things significantly for us, which has already started.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Maxim Topaz, the Elizabeth Standish Gill Associate Professor of Nursing at the School of Nursing and the Data Science Institute at Columbia University and Senior Scientist at VNS Health, about nursing's role in AI in healthcare. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks so much for joining us today, Max.
All right, you're welcome. I'm looking forward to talking to you.
Wonderful. Well, this is a huge topic that I know nurses are learning more about, interested to understand how it impacts their practice. So I'm excited to talk with you today. So to start things off, what is AI and how is it used in healthcare overall?
AI is spelled out as artificial intelligence. And what we're trying to do in AI is build machines that think like humans, right? So build smart, and usually we refer to computers in today's world, right? So we're trying to build smart computers and smart software that can resemble human thinking. So that's kind of the essence of AI, right? And that's been for years.
That leads me then to my next question is, in general, and I know we'll dive a little deeper into this soon, but how is it used generally in nursing practice currently?
It's interesting. As an AI scientist, and that's what I've done for the last more than a decade, we definitely see growth in terms of development of AI. Integration to nursing practice, I think, is still somewhat limited, but I think the horizon, the trends that we are seeing today are indicating that this technology is just going to explode and be integrated into everything we do in nursing, or many of the things that we do in nursing, and that's going to change things significantly for us, which has already started.
Can you give us any examples, maybe from your own AI projects in nursing, of just some of the possibilities that you see?
Yeah, so really hands-on example, something that my lab is doing currently. So we have a series of studies that are focused on applying speech recognition technology. Basically, imagine a situation where a nurse interacts with a patient, and many of our use studies are focused on the home care environment. So basically, nurses come into the patient's home and providing care there. But this technology is also applicable in the inpatient settings and ambulatory settings, other types of settings. So imagine a situation, right, that you are discussing health problems, you're discussing interventions, you're discussing, other issues related to care coordination, things like that with your patient. We are recording those conversations, audio recording, and then we're extracting meaningful information from those conversations. And this information, usually in my studies these days, so studies that I lead right now, we are using this information to be able to identify patients at risk. So people who are deteriorating, who are not going to do well. And in the home care environment specifically, this means that we are identifying people at risk for hospitalizations and emergency department visits. We know that a portion of those events can be prevented, right? And we want to save people, our patients, this trouble of going to the hospital, and their condition getting worse for multiple reasons, right? So that's what we're trying to avoid. So we're using this AI that can listen to you, basically talk to your patient, right? And then can help you summarize the conversation. So that's kind of the first immediate thing I think that's coming to, that's on the horizon today. Physicians have been using this technology to summarize their clinical notes, basically, for years. The technology worked somewhat differently because it used to be that they would dictate their clinical notes and somebody on the other end of the phone will record this and transcribe this and then send it back to the physicians, right? Today, technology advanced so far as to automatically and accurately transcribe communications, right? And then you can act on these transcriptions, basically on the text, and extract meaningful information from that. And again, one very low-hanging fruit, but something that bothers nurses a lot and other clinicians, right, is documentation burden, for example. So we spend about 30% to 50% time, our clinical time documenting, right? And this is just such a burdensome thing that we have not trained. That's not why I became a nurse, for example, or, many people became physicians, but we end up doing these administrative tasks. So if this automated speech recognition approaches can make some of that go away, it is considered a low-hanging fruit, and it is becoming increasingly implementable and viable today. And, it wasn't even a couple of years ago when we kind of started doing that. It was a lot harder to do. But today, with proliferation of different AI technologies that can really talk back and recognize the voice, this became a lot easier to do. So that's kind of an example where things, I think, are going to shift. One of the examples, right? My team specifically uses this technology to then mine those conversations with patients and nurses, and then identify patients who are deteriorating, who are not doing well, right? And then intervening on time.
How exciting. I mean, just the idea of the documentation piece alone is enough to get me jazzed, because you're right. I mean, that, as you said, it's a low-hanging fruit, but it's also something that I don't know that nurses have been part of that conversation before. You mentioned that physicians and actual providers have had sort of access to certain technology to kind of help make their work more efficient, but nurses are kind of just sort of waiting for us to have our turn. So it sounds like our turn is coming on the horizon as this technology has advanced and become more accurate. And so that's exciting to see. I just think that the documentation burden that you bring up is a huge issue, and all the time that would be opened up for nurses to do other more important things, sitting with their patients, talking with their patients, if they weren't stuck at a computer, clicking boxes and typing in information. That would be just a huge win. So one thing our listeners may be familiar with, we've heard the term ChatGPT, which is a generative AI model. But to ensure we're all on the same page, myself included, can you help briefly just define what generative AI is?
Yes, I can define the medical technology. All right. So basically what ChatGPT is, conceptually, it is very simple. So imagine scrapping a lot of text from the web, right? So just creating a web crawler, right? Something that reads all the information on the web. Imagine saving that on your computer, right? On a very large computer, right? It can save a lot of text. And then what the ChatGPT type models, right? So ChatGPT stands for Generative Pre-trained Transformer. And what those models do, basically, they're doing a very simple thing. They're learning to predict the next word based on a sequence of previous words. So if you're asking a question, or if you're the easiest example, I think, if you are using common terms like Mary had a little and then leave it blank, models like ChatGPT would come up with the next most reasonable thing to put in this blank space, which is going to be Mary had a little lamb. And then, it's going to continue like that. It's going to look then for the next most reasonable word, for the next most reasonable word, and so on, right? So that the thing is going to continue generating words. Conceptually, it's very simple, right? So my team started working with ChatGPT specifically, right, with this model. So we worked with GPT-2 4 years ago now. And we used it to basically, working in this space, in general, the technology that ChatGPT uses is called natural language processing, right? So natural language processing is a field where we analyze text using computers, basically. Those generative models emerged about, 6 years ago. And then we started using them, right, and seeing the potential. So 4 years ago, we did this experiment where we fine-tuned, basically, we trained ChatGPT model number 2, which we have number 4 right now, right? So we trained GPT model number 2 to generate nursing notes. And then we had a couple of nurses read those clinical notes. So we mixed them with notes generated by humans and by real nurses. So we mixed those, and so we had half of the notes written by real nurses, right, and half the notes written by GPT. And then we asked nurses basically blindly to look at each note and say whether this was generated by a robot or a human, right, by GPT or a human. And, even 4 years ago, nurses failed to distinguish between those two. So it was really hard to distinguish. So, the technology was there 4 years ago. It could write things that resemble human thinking, right? Basically human writing. But that was just the beginning, right? So today, what we see that this technology is capable to do is just mind blowing to me, because I couldn't imagine. Okay, we looked for years for use cases for that. Okay, this technology can write clinical notes that resemble nursing clinical notes, right? But what else can you do with this? So today, I think this technology advances. Every week, there are updates to this technology, specifically ChatGPT technology, that are not incremental, I think, that are pretty revolutionary and are making me excited about this field. I was excited before, right? But I was very skeptical actually before the recent advancements in the last year or so about our ability to get to a place where we would interact with those large language models, for example, right? And have a meaningful interaction with them. Really, those models will help us in multiple tasks, right? Because previously we used to train those models to help in one specific thing. So for example, right, ask about the weather, right? If you think about Siri or Alexa, those chatbots, right, they were able to answer one specific thing. Now, this technology, so a technology like ChatGPT can basically answer a range of questions. And over the past year, this technology got so good that I'm using, I'm an evangelist. So I'm using the latest version of ChatGPT as soon as I could pay, for whatever they have there. I started paying. So I'm using ChatGPT 4. And I don't think ChatGPT 3.5, the publicly available model, is as good as 4, because 4 is really, in my experience, revolutionary. For me personally, it saves about 30% of my time right now, I think, that I spend on, it's mostly kind of administrative or writing tasks that I have, but it definitely helps, right? So that's just a little bit about this technology, right? And how magical it is, how unbelievable it was a few years ago. And today, this technology can do multiple things, like translate from. So I recently been in Japan, and I worked with my Japanese colleagues. We needed to write clinical notes, create a subset of clinical notes, for example, in Japanese. And, ChatGPT was able to do that pretty well without any training, right? So and it wrote clinical notes in Japanese. Then it calculated complicated things for me, so complicated kind of research findings. It was able to calculate things and was able to explain the results, was able to provide light, to kind of shed light on what's going on in terms of trends. Multiple things that were far, I thought personally as an AI researcher a couple of years ago, but today it's happening, right? So I'm continuously excited and, in awe of this technology.
It is sort of a little bit mind-blowing just to think about not only how quickly it's changed and advanced, but like you said, what are all of the even possible applications that even a few years ago seemed impossible. And now it's like we can't even think of all the ways that it could be used. So it is exciting, but it also makes me a little nervous. We'll talk about that here just shortly. But do you have any examples of how generative AI models, as they've become more advanced, are influencing oncology nursing practice or oncology care specifically?
So just in general, right? And I think, as you said, Jaime, right, this technology is emerging, right? And I think my goal right now is to try to see how do we use this technology appropriately for nurses in general, right? Including oncology nursing. The use cases that I can see are multiple. And, one thing is, again, about generating a summary of your care, right? Of if the interaction with you and the patient can be recorded, then some summary can be generated. Now, in oncology, there is a lot of things that machine learning in general, right, including technologies like ChatGPT can do. So optimize therapies, right, identify the most precise, personalized therapies. I know this is an active field of research that a lot of people are, using this technology for. Then maybe creating better communication with patients. So kind of helping us communicate with patients in a way that patients don't perceive as judgmental or anything like that. So kind of helping us communicate with patients. That's another use, right? That's going to be relevant across all the medical fields and nursing fields. And then, so these are some of the broad, I think, applications that I can kind of envision, right, for this technology. And I know that lots of people are working on those.
And I think it's probably not the Chat GPT model, but just AI in general. We're seeing or I'm hearing reports of how this technology is being used in fields like interventional oncology and diagnostic and screening, where it's sort of facilitating what was once a manual radiologist reading every single scan, but now using some of those patterns and that technology to help reinforce, and actually they're able to duplicate with the same specificity and consistency of how those scans are read. And so being able to increase the efficiency of that. So those are just, while that's not maybe nursing specific right now, those are other things I'm hearing about how this technology is being able to kind of supplement what was once a very manual individual process.
Yes, exactly.
Can you share some of the evidence or maybe some current expert opinion on the notion of algorithmic bias as we're talking about these chat GPT models and how it's pulling information and kind of summarizing it and predicting what will be the most sensical thing to come next? The concern is now raised about incorporating bias into those models. So can you talk a little bit about that and any ethical concerns that you know of surrounding the use of AI in healthcare?
That's a very important question, right? That we're starting to grapple with. And, we've dealt with that over the years, right? But right now, with such a fast technology proliferation and development, this question becomes critical. I believe that we as nurses we should be advocating for that. We should be evaluating any types of AI technologies that are coming into our practice, right? That are being increasingly applied on the basis of their ethical implications and how biases affect what's being kind of told, what we're being told by those technologies. So I'll give you a couple of specific examples. We have a series of studies where we are identifying patients at risk, patients who are deteriorating in the home care settings. So to do that, we are using the most advanced technologies like GPT and other technologies that can read the clinical text, right? So we are integrating data from the electronic health record, including your drop-down boxes, right? That, nurses click when they admit patients, for example. And this your social demographic information, right? Disease characteristics, things like that, functional status, right? Plus, we are extracting a lot of information from the clinical notes. And over the years, we've shown that by combining those data sources, you can actually achieve a pretty good risk prediction performance, right? And I know that those things have been proven as well in the field of oncology, right? So this is a relevant domain, right? Where AI right now is actually pretty good, right? So we are able to use electronic health record data to identify patients who are deteriorating or not doing well, who are, for example, going to go to the hospital, right? Or going to have some type of an adverse event, adverse reaction from medication, things like that. Now, when we build those models, we take data that's coming out of the electronic health record. Now, each country, right? Any country, and I have an international background, so I lived in 3 countries a significant portion of my life, and that lends kind of helping me understand the biases in each place, right? So there are different types of biases in each one of those countries that I lived in. And, in the US, there is a lot of racial and kind of ethnical biases, right, that are embedded into the society in a structural way. Now, this is going to be evident in the electronic health record. When we document things, this is going to be captured. When we look at the outcomes, this is going to be captured. So when we build machine learning models using the secondary data that kind of captures those biases, then this propagates, right? So their ability, those machine learning models, they just learn patterns from data. So they're going to be biased as well as the data that goes in, basically, right? So we need to find ways to fix that. One specific example of biases that are embedded in the machine learning models, it was a few years ago, there was a big scandal with a risk prediction model that basically a large insurance company was using to identify patients at risk and then, provide interventions. In terms of the outcome, they were looking at how many interventions people receive. And, if you take a white patient and a black patient in a specific study of the same clinical severity, you would see that the number of interventions that white patients would receive were significantly higher, even if they were as sick as the black patients, or vice versa. Even as black patients were as sick as white patients, right, they received significantly less interventions, actually. And this is kind of embedded in insurance practices and where people live, other things, right, in the US. So the resulting machine learning model was replicating some of the same decisions, right? So it was predicting that black patients, even with the same clinical severity, would need less interventions, right? So, people discovered that and it was a big scandal. The model was adjusted for that. Now, this happens with our models too, right? So the model that I described that we use in home care to identify patients at risk, it also works really well for some people and it doesn't work really well for some other subgroups of people, right? Based on your characteristics. And what we're doing right now, we're going deeper into this, right? So, okay, there is a racial divide or racial disparities, right, in the US. But really, when you think about the person, right, you are never just one race or ethnicity, right? You are a unique person. You have a combination of multiple factors. So, say disability status, right? And how, what are the disabilities you might have? Then where you live, and we know that zip codes in the US are determining a lot of what's going to happen to you. Then maybe your gender as well, defines a lot of things about you. So when you put all of those things together, right, and you look at, say, performance, like risk identification performance, risk identification accuracy of machine learning algorithms, interesting things emerge, right? And those patterns they're not necessarily always like, working less well for underserved populations. Sometimes they actually do work really well, right? But this is something that needs to be examined in, say, risk prediction algorithms or any machine learning algorithms. So these days, we're starting to spend a lot of time on doing this work, right? And basically evaluating machine learning models for the embedded biases and then trying to fix those biases, right? And it's not obvious actually how to fix that because this becomes very complicated really fast. So there's more of a value judgment when you think about how to improve those systems. Because if you think about like what kinds of metrics should you prioritize for those machine learning models, specifically, right, should those models work as well for everybody? So let's say, right, they predict risk with a certain accuracy. Should this accuracy be kind of average for everybody? Or should we improve accuracy for subgroups, especially underserved subgroups? Something like that compared to the average accuracy. So, this becomes complicated really fast and the decisions need to be made, right, on kind of a specific use case scenario, right? So like, you need to think about your population. You need to think about your specific setting, right? You need to think about what are the historic factors that kind of influence what's going on in practice, right? And what is your kind of moral compass? And then you make decisions about how to fix machine learning algorithms. That's a really interesting field. And this is just, again, it's an emerging field, right? We are starting to look into this right now. But this problem applies to many of the, machine learning and artificial intelligence type applications.
We at ONS, and I think the nursing field in general, has spent significant time, especially over the past few years, of just emphasizing the need to evaluate one's own sort of implicit biases that you might have as you're engaging with patients and providing care, and kind of addressing those, mitigating those before care is conducted, so that you're not, influencing what you would do based on a bias that you might naturally hold. But it does make you think now it's not even just maybe the words that you would say or the way that you approach a patient, but now it's even getting so granular as to the words that you use in your documentation or what you include or don't include in your documentation, and just understanding the impact that can have as we start to implement this type of technology. Of it's sort of rolling up into a bigger thing, and it has the potential to sort of exponentially impact the care that is provided or the recommendations that are given. And so I think for me, it really hits home how important that education is for nurses, both, still in nursing school and even those in current practice, of just evaluating kind of what the care you're providing to patients, the documentation that you're including in the record, and just having that awareness of like, what is it feeding? What other technologies and things in the background that we don't have that sort of tangible access to. We need to understand kind of how it's being used to create some of those things. And I think it's a great example of how we need to ensure we have nurses and clinicians in this field to be able to help inform and then also bring that information back to the educators so that we can make sure our practice is evolving to keep up with the technology that is now kind of influencing it.
So Jaime, let me give you a specific example of what you just described, right? So this is the most recent funded study that we have. So we were just funded to conduct a study we call Engage. Engage is a large grant that's going to look into lots of nursing nodes. And what we are starting to see is basically what you described, right? That language. So as a clinician, right, when you see your patient, then you go document your care. Sometimes we use language that, furthers kind of social biases that we have about people and just social norms, like it's fine, right? That's how we live in a human society, right? We interact with each other. There's a bunch of norms we have, right? And it's all, our language reflects that basically, right? But what we see, right, emerging, and we've conducted a study, for example, where we looked into documentation about different types of patients, and we looked for a specific thing called the judgment language. So let's say an example of a judgment language would be something like when, I come to the patient home and they say they quit smoking, but I see evidence on the contrary, things like that, right? I'll use a judgment language. So what I would write in a clinical note would be something like patient claims they quit smoking, right? But full ashtray next to them, something like that. And then words like claim or, sometimes state, words like adamantly insist, words like refuse, care that I think as a clinician is relevant for the patient. They're all indicators of this specific thing that's called, judgment or just in general stigmatizing language, right, that we use against patients. Now, my team applied natural language processing to identify those words and expressions in clinical notes written by nurses. And we identified that this language, this type of language, is more frequently used among minority patients. So specifically for us, we looked at Hispanic and Black patients, and we found that among those patients, this language is used at about 20% higher rate, right, than among other patients. That's what we're seeing. That's what's emerging in the other literature as well across multiple types of healthcare settings in the hospitals. So my team has done work in the hospital and obstetric settings and in the home care settings. So yes, right. As you said, we do see this disparity there as well. So, a lot more of the stigmatizing language or judgment language, right, is being documented against minority patients or among minority patients. So this is especially relevant right now where about a year ago, there was a legislation that right now allows each patient, right, you as a patient, if you come see your healthcare provider, regardless of where they are, you should be able to have access to your electronic health record documentation, including clinical notes, right? So, there were studies that looked at what people think when they see their clinical notes. And this is about 20 to 30% of people actually felt offended by what they see in the clinical notes described about them, right? So, and again, right, we do see a racial and ethnical disparity in that. So how we're thinking about fixing that in the study that was just recently funded, we are thinking about, first of all, building a system that will accurately identify and automatically identify this language in the clinical notes. And then, we're thinking about something like a spell checker, right? Like in Word or any type of other language processing application, right? You have like suggestions and spell checkers, right? That tell you, hey, this is misspelled, right? So what we are thinking right now, right, the language, that's a very simple approach, right? It doesn't change your internal beliefs or attitudes, right? But, very simply, this language can be corrected, right? And if you write something that's, some people might find offensive, right? Then there will be some of the spell checker, right, that will suggest several alternatives for you, right? You can keep your original language as always with those tools, but, there are going to be alternatives. They're going to be suggested to change your language and make this language less offensive, which, in turn, we see that not perpetuating biases, right, as you described as well, through language is going to have a positive effect on the outcomes, right? Because we've seen studies where, for example, as a physician, when I see a clinical note that describes a patient in a certain way, in a judgmental way, right, my likelihood of giving them treatments and the quantity of treatments, so, the specific study about painkillers, for example, they were less likely to receive painkillers than patients that don't have, judgmental language included in the clinical notes. So we do see, and, in home care, we found that patients with judgment language, their nursing visits were shorter, about 15 minutes shorter or something like that. And this is concerning, right? Because those things, they kind of affect the quality of care down the line. And then, it's going to affect patient outcomes, right? So they're actively exploring, what kind of outcomes are affected. But if you change this language, right, that's interesting to explore whether, that's going to it's going to have an effect, right, on the higher quality of care, which it might, and then, consequently patient outcomes.
I'm just overwhelmed. I don't even have like coherent thoughts to provide because it's just like the possibilities, the risks, the opportunities. I mean, all of these things are living together, but my brain is even like, can't even wrap around it because it's just so rapidly changing. So we talked a little bit about some of the bias and the ethical concerns around that. I think there is a broader conversation nationally, globally, just about some of the risks with AI and kind of helping to make sure that we are setting up kind of safety measures and sort of guardrails as this technology sort of explodes. What are some of those urgent discussions going on around AI and specifically with regard to healthcare? And is there a role for nursing in kind of helping to identify those or help lend their voice to that conversation and that advocacy?
I'm a part of this international collaborative. It's called Nursing and Artificial Intelligence Leadership Collaborative. We have a website, so if people want to check it out, it's called NAIL, Nursing and Artificial Intelligence Leadership Collaborative. We get to think a lot about that kind of ethical implications, right, of technologies, emerging technologies. We have resources there, papers that we've published, for example, on the topic, right, how to kind of ethically use technologies and what, as we discussed, what is the role of nurses, right, in this technology and how critical is that for us to be involved to make those technologies work for people. So that's one thing I want to mention. So you're asking about what are we currently focusing on, right? What are the efforts that are being done to mitigate the biases? I agree with you. Nurses play a central role, right? Again, in terms of looking at the technology, right? So, the traditional approach is that nurses are given some type of technology, right? And they're asked to use that basically. And then, there's not much back and forth, right? If there's no like critical flaws in that, then, if it's safe to use for the patient, right? Then the technology is going to be just kind of applied and nurses will just use that, right? So that's kind of the assumption, right? Now, with those emergent technologies that are AI technologies, so risk prediction algorithms, let's say in clinical practice, right? Or even, if you're thinking about all of those devices that we have now in the clinical practices, right? Like, even the blood pressure devices, right? That beep on you at a certain point. This is all somewhat, of an AI technology because, you set those levels, right? The levels when the technology alerts you on the risky trends, right? It's also part like what is being done basically in the background, right? There's some kind of algorithm, right? That is being run there and it identifies dangerous trends according to this algorithm, right? So all of those algorithms, again, they have flaws, right? And as nurses, us applying this technology, interacting with patients 24/7, we do see a lot of issues and we do have the moral obligation to understand what are those issues, right? And kind of then report it back and try to fix the technologies in whatever way we think is appropriate, right? Again, those ways are different, I think, for different kind of use cases, right? But we do have, a huge role in that, I think, as nurses, again, the largest sector of healthcare providers, right? And I don't see like resistance, basically, right? So I'm involved in, national forums, international forums, right? That are focused on AI. As a nurse, right, I'm bringing my nursing lens. I don't see resistance, right? I don't think there is a resistance from people and, that somebody is actively preventing nurses from participating, right? The barrier is often in that, we are clinicians, right? So we're trained clinically. We're not trained to think about those things like AI or something like that. So, kind of lack of knowledge, right? And then also, there's lack of education, as we mentioned, right, among folks. So, technical folks, right, that would not understand what's the critical role of the nurse, right? How nurses are going to be key in any technologies that I'm developing as a technical person, right? What's this critical lens that nurses bring, right? Discussing ethical issues, discussing implementation issues a lot, right? Is this technology going to add burden, right, or not? So all of those aspects, they are key, for technologies to succeed, right? And some folks might not realize that unless they kind of learn about what nurses do, right? So there is this image problem to some extent. I have not seen a resistance, right, basically. So like people do want clinicians to get involved and, everybody wants to work with clinicians, right? So that's kind of the positive thing. And yeah, we just need to put ourselves out there, right? And these are the efforts that, many people are doing right now, kind of pushing clinicians to get involved and think broadly about technology that they're applying, right, in specific use cases.
Wonderful. Well, that I think brings me to my final question. So we've talked about sort of a knowledge gap, maybe from both sides. So for nurses that really are interested in this and do want to kind of dive in and learn more, maybe they're not ready for their PhD, but they want to learn more and become more fluent in the concepts and the conversations around AI and how it's going to impact their role as a nurse. Do you have any recommendations on education, resources, things that nurses can tap into to kind of dip their toes in it a little bit and become more familiar with what this landscape holds for the future?
There is a variety of resources right now that are available. And again, here things are changing so fast. But, the traditional set of resources, right, I would often describe to people is like if you're interested, for example, understanding what role the technology plays in healthcare, right, and what kind of applications are common in healthcare technologies. There are a variety of massive open course platforms, right? MOOCs, they're called in short. And those are, the popular platforms are Coursera or edX. And those platforms, they all have a course on health informatics, for example. And so those courses will touch on central aspects of like AI development implementation, right? Basically. And again, the field that today, kind of the name for this field, I think, is changing to AI, right? We used to call this informatics. So, that's kind of the traditional name, right? That what you would search for on those platforms. So like healthcare informatics, right? I have a course on EDX, right? This platform that thousands of people from more than 50 countries have taken and learned about informatics. I hear feedback from like unexpected places, around the world, always about this course. And these are, again, open access, free resources, right? That you can just educate yourself kind of what's going on, what are the current trends. So that's kind of one approach to that. Then, if somebody wants to get more specialized, right, you definitely have a variety of courses online that you can do, right? And kind of educate yourself about, say, a specific type of machine learning. So like text mining, right? How do you process text? Or how do you build risk prediction models? Again, those MOOC platforms that they offer a pretty nice alternative, some other things. And those other things include like formal courses, right? You can take at universities, for example. So that's kind of another thing. But today, I think like it became, just things are changing, rapidly. So with this product that I described from ChatGPT, that's called data analytics, for example, right? You can have some data. You cannot put like any clinical data there, right? Because that's, it's company and, nobody would allow you to do that. Things are developing fast, right? So soon we're going to be able to use those in like hospitals and things like that. But, so far, right? It's a company. You can use exemplary data or some type of fake data, right? To kind of see how the technology will work for you in terms of data analytics, right? So like have a data file with some type of an outcome, and then ask this technology to kind of analyze this data, describe it to you, report trends, right? And then maybe perform some data analytics, say, what intervention is the most helpful in this situation or that situation, or identify patients at risk, suggest a couple of approaches to me and guide me through developing like risk prediction model, for example, right? So something that we call query engineering, right, is like the latest thing. I think that's the skill that we will need to some extent. So query engineering, right, when I ask GPT questions, right, ideally I would give it examples of how. So first of all, right, my question is going to be very detailed. It's going to be describing the context, right, because like I can ask, what color is the sky, right? And the answer, for technologies like GPT, right, you need to describe like what I really want to know. You want to understand how the sky is blue, what are the physical reactions that happen, right, to make it blue, right, and the, color spectrum things. Or, like you just want to, kind of naively know what is the most common color hue, right, that's in the sky. So like you would rather specify your question, right? And then you would rather provide an example of like how you want your answer to look like, and maybe a few examples of that. Then this is something that we call prompt engineering, right? Basically, if you ask your questions correctly, right, I think this emerging technology can provide you with lots of answers that you previously needed lots of skills to do, right? And like you needed skills in programming, you needed skills in maybe really deep understanding of like how electronical things work, that there are chips there, right? And, binary systems. But, again, today it's becoming easier and easier. So I think the barrier, like this is the good news. I think the entry barrier, right, for us in nursing is decreasing. And as you said, this technology is embedded into everyday life. There is a race now among the largest technology companies, right, to implement this technology. So it's just emerging every other week, right? Or in the same week, you have multiple things that are emerging and they're so cool. I think that's going to be a natural transition, right, to some extent. Now, like us getting exposed to this technology is not going to be forced. So like we're all going to learn about that from our interactions with technology, whatever. You talk to Alexa, right? It's going to get a lot smarter. It's going to ask questions. And how is it doing that? It's based on large language models, right? That's like, you kind of don't need to be an expert in the field to understand, hey, it's capable of doing that, right? And building this technology is becoming easier. So these are the good news, right? I think we're naturally going to kind of transition there to the point of where we're going to know a lot about those technologies.
Absolutely. Well, and I think you provided some great examples of there are educational resources out there, depending on how deep and how complex the information is you want to learn. Maybe it's actually understanding how it works and how it's built and how it actually processes. Sometimes you just want to know, like, well, how am I going to use it? And what do I need to know to make sure that I'm, entering the information into the system in the correct way so that the eventual output or the outcome is based on kind of good, valid, true information. So I think there's endless supply of information that we as nurses need to know. And if those that are interested in learning more about sort of the technical, sort of informatics-based information, it sounds like you've provided some great resources that we can explore just to help kind of backfill that information that we need. I think the most important message I'm hearing is that as we as nurses learn this information and become more comfortable with it, it's going to be important that we are sharing that with our colleagues, understanding how we can spread that information to whether it's our unit, our department, our hospital system as a whole, just making sure that we're bringing all of our colleagues along with us as this information takes off. So I'm looking forward to those nurses who really are interested and really do maybe have an inclination to being more technically inclined to sharing that information with all of us so that we can continue to learn and grow and keep pace with this technology as it quickly influences and changes the way that we document our care. We have information given to us that influences the decisions that we make. I'm just excited to see how this changes and see nurses be at the forefront of that.
I agree with you.
Well, thank you so much, Max. Man, my head is spinning, but all in good ways of just all of the new things that I need to learn about and continue to explore in my own practice. Do you have any final comments or any final words that you want to share with our listeners today?
To finish off this conversation, right, with you, it was a pleasure. A couple of things that we've mentioned, right, is that I think for in nursing, right, thinking about ethical aspects and thinking about some of the biases that can be embedded in the technology, we're really good at this. So I would, definitely encourage nurses that are seeing explosion of this technology to think about those trends, right? And kind of not just blindly apply this technology in practice, but, think about what implications does it have for our patients, right? So having a patient in mind is, having a person in mind, right? It's kind of a central thing. And that's what we're doing every day. So it's really easy for us to kind of see that. It's not easy for other folks to see that. So we need to identify any potential issues that are kind of emerging with those technologies and then bring this up to the attention of other folks who work in technology, for example, development or implementation. That's kind of our job. Also, our job is to really critically look at the technology and evaluate if it fits our workflows, right? And kind of make adjustments to the technology again, working with the technology folks for them to give us, better technology that kind of fits our workflows, fits what we do in nursing, right? Which is providing patient-centered care that's based on the most updated guidelines or recommendations. So yeah, and again, I would encourage people to get exposed, right, to the most recent things that are happening, which is really easy today, right? Now there are multiple podcasts that are on the topic, very brief podcasts. For example, we're providing an extended version here, but very brief podcasts that will summarize the news for you on AI, right? And there's no escape today. Hey, if you're going to be exposed to that, your kids are going to do homework with GPT, you will learn about this technology one or another. So this is my kind of concluding thinking, right? And we mentioned a couple of resources that people can use throughout this conversation. So, and I'm happy, if people want to reach out to me, happy to provide any further comments. People can find me on the internet. You'll find my email at Columbia University. So, feel free to reach out.
Wonderful. Well, thank you again, Max. I am just blown away by all of the ideas you've discussed today, and I'm sure our listeners will appreciate this first introduction, perhaps, on some of the details, but look forward to learning more as this technology grows. So thank you so much for sharing your time and your expertise with us today.
All right. Thank you so much, Jamie. It was a pleasure.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.